At the moment, the Vuma vaccination drive is still underway. Thousands of people getting vaccinated most days of the week at the moment. Still some issues getting younger people at institutions of higher education vaccinated. Dr. Ramneek Ahluwalia is the CEO at Higher Health. Dr. Ahluwalia, good afternoon to you and thank you for your time. When you look at the number of young people getting vaccinated in higher education institutions, what are you seeing? Are most people coming through to get a jab?
Good afternoon, Stephen, and thank you very much for having me. Stephen, we've seen now, and clearly what data is coming and what we're observing on the ground is that we've got three types of population, which is equivalent like one-third, one-third, one-third. So the first one-third, I think we've already reached out. We kind of at least got the first jabs in. They were very enthusiastic. They believe in the science. They believe in the vaccines. They were even willing to stand in long queues when we brought the vaccines in the higher education sites or our own vaccine points. But then we called something called the middle one-third, and that's where our entire strategy for this whole Vuma week has been. And the strategy has been this middle one-third. This middle one-third believes in the vaccine. They understand the vaccine. They're reading a lot about the vaccines. But they have doubts. They have genuine doubts. They have been reading social media. They've been a little bit influenced by the anti-vaxxers. They've got issues like whether our testicles will be increased, or they've got issues like whether I'll become impotent. These are critical issues in young lives, and that affects them in their thinking and people believing in. So what we do is we're trying the whole process is to convert this middle one-third to us by clearing their myths, by talking to them, engaging them, even taking ICU doctors with us in our consultation, so they show them the real picture, what is in the ICU, and their observations of what their myths are can be demystified by actual practice of doctors in reality. But then we have the last one-third that we clearly observed are absolutely hesitant. They're fully influenced by anti-vaxxers. We just need to now figure out what is the right way to get them. But should we reach the middle one-third, which is our first easy win, we can at least get two-thirds of our population, which will at least help us to what we want to achieve.
So the people who are hesitant, I mean, you talk about incentivizing them. Is that quite difficult to do? If it works for younger people, do you think it'll work for older people? Because we still have a lot of people in our general population, not students, who are vaccine hesitant.
So you know what, Stephen, interesting part is that when Eastern Cape predominantly, and now the data is coming from other provinces too, that when we started vaccinating our young people, our educated young people in institutions of higher learning, the last stages of high school, the 18 years, the 19 years old, we automatically started seeing the older age group coming. So there was a big influence of these young peers going back and explaining the rationale, because they got converted into what we called vaccine promotion. So this peer influence of young people on older people was clearly evident. Eastern Cape is a perfect example. We started seeing numbers of older people now coming out once we started infiltrating the young people. A similar trend we've now started seeing in KwaZulu-Natal, Gauteng, and also in Free State. So these are very good positive trends in provinces where we're seeing from young people, parents, guardians, old people coming. So incentivizing young people or building young people to believe in will automatically convert a bigger population to come in. But undoubtedly, vaccine hesitancy is huge. It's a massive challenge in front of us. And if we want to fight COVID, the trajectory looks tough if our population doesn't change their mind soon.
And I mean, one of the problems is that we need to kind of get going. I mean, I mean, you talk about soft incentivization. The other way to do it is to sort of make vaccines mandatory. Are some institutions at higher education thinking of saying, well, to some campuses, you only come on if you're vaccinated? I mean, some workplaces are doing that now.
Critical discussion. The regulations, we don't call it mandatory, we call it regulations. Regulations on vaccinations, which is absolutely a burning issue. It's a critical issue. And we encourage this at this moment. At this moment, our call is, let's keep consulting. So we have on this Friday a consultation with lots of unions just to understand their dilemmas around both regulations and vaccine hesitancy. How do we balance the two? We just 1 month and few weeks into opening this program to above 18. And we believe that we need to give more time to people to make their decisions. The vaccine program is maturing on a daily basis with more easy vaccines coming onto our campuses, which is obviously giving students more chances or young people more chances to vaccinate because they are hesitant to go to the hospitals. It's clear from our observational data. They want not hospitals, they want on the site. So regulations, yes, but we're looking at a phased regulation approach. A phased regulation which we are looking from consultation is faculties of health sciences first, because not only that the faculties of health sciences are on high risk, but they can actually carry the virus and give it to the patients because they are in direct vicinity with the patients and in occupational health risk at this moment. Then residences, where we have close people living together, residing, eating together, and that's going to be our next big issue of understanding how the regulations will help in that phase. Should we move in that direction very quickly? The third one, obviously, is the comorbidity. So it's that kind of consultative phased approach thinking that we're now debating, and some institutions are unique and they need to move a little bit more aggressive than the others.
Dr. Ramneek Ahluwalia, CEO at Higher Health, really do appreciate the time. Thanks very much indeed.